Hello and welcome to the following edition of Talking UN, an initiative of the UN Information Office in Uzbekistan. Earlier in our previous edition, we were joined by Steve Monaco, who's the representative of UNODC in Uzbekistan, Senior Law Enforcement Advisor. He answered our questions, any questions sent by you and by the general public on our social platforms. And today we are joined by Jean-Michel Delmotte, who's the representative of Unicef to Uzbekistan. Thank you very much, Jean-Michel, for joining us for this edition.
My pleasure.
Talking UN. My first question to you is, recently Secretary General has launched a new project called Education First, and one of the priorities of this initiative is improving the quality of education, and we know that Unicef in Uzbekistan is also pursuing the improvement of education in Uzbekistan.
Absolutely.
Partly. So could you please say a few words on the progress made in this area so far?
Progress has been made, certainly. UNICEF has an interesting initiative which is called Child Friendly School, which actually is more than just friendly. It's about overall reform of education, basic education, with a focus on improving the quality. So what does it mean in child-friendly school? Child-friendly school means that the school will be certainly centered on the child in all aspects. So they look at the effectiveness of school, which means that the learning will be improved, but also they look at the environment, at the healthy environment of the school, which means that children will be provided with adequate food, adequate nutrition to be able to learn. It means also the school should prevent the children to be harmed in any aspect. So the protection aspect of the learning is also there. It means also that the child is giving opportunities for participation, interaction, which may change not only in the curriculum, or not too much on the curriculum, but more on the pedagogical approach, where the teacher and the children will interact with each other, giving certainly credit to the participation of the school. Now, what do we do? It's not recent, actually. We have been working on child-friendly school for a few years, and currently there are 1,000 pilot schools. So it's a little bit more than a pilot with 1,000 schools. We still work with this school, for which the initiative started certainly in the early 2000. Now we still follow in 7 regions of the country this 1,000 school, ensuring that the teacher, but also the management, the school director, are getting new skills and new possibilities. So UNICEF is currently inputting in this region with the Oblano, which means the regional authorities, to the skills of the teacher, the pedagogical, but also the manager of the school are improved to make the school centered on the child, and therefore child-friendly school. So we are creating, like through this process at grassroots level, every year, thousands of new, not new job, but new way of doing job for both the teacher, but also for the management and the school director. UNICEF also helped the Oblano, the regional authorities in the education sector, to monitor the progress that are being made. And the progress are being made to an extent that, and this is the second aspect of UNICEF being involved in child-friendly school at the upstream level, by ensuring that the good lessons and the lessons learned from this child-friendly school project is becoming now a national policy. And we are extremely proud as UNICEF that Uzbekistan has been one of the first countries in CIS to have adopted the child-friendly school approach for the entire reform of the education sector. Let me clarify that certainly Uzbekistan has made a lot of achievement on the basic education, and in the beginning of this year there was this international forum with the invitees from not only from the region but from all over the world came to see the Uzbek models, and we are proud to demonstrate that UNICEF commitment is also to accompany the country in improving the overall quality of the schooling. And this is being done by this child-friendly school. Something I would like to mention, which is very specific for 2012, if I still have 1 or 2 minutes on education, is this year UNICEF has been also the coordinating agency for preparing for the first time ever in the history of education in Uzbekistan of an education sector plan. This is a very ambitious project. This is a project that trying to build up the vision of education in Uzbekistan on a 3-4 years period of time, up to 2016-17, and which cover the 8 aspects of education, from preschool education to higher education, inclusive of special school, for instance, children with disabilities or literacy. And this program, which has just been finalized very recently, has been adopted by Cabinet of Ministers, is being adopted by Cabinet of Ministers, but also is now the focus of interest of the international community to an extent that big donors are now considering giving their support to the country through this program, which means many things for UNICEF. It means that we have a good program, we have good activities in this program, but also the funding of other bilateral or multilateral donors will come to this education sector plan with a coherent vision. And I think for us working for the UN is an important achievement of 2012 in the education sector.
Thank you very much. My second question is about a recent development, not only in the life of UNICEF, but also in the life of UN. I mean, the Global Handwashing Day that was established in 2008. And UNICEF made a statement about hand washing with soap, which it says can save millions of lives and half the number of people dying of pneumonia, diarrhea, and other infectious diseases. So to be more specific, my question is, how was this day celebrated in Uzbekistan this year? And if possible, could you tell us more about events and campaigns conducted by UNICEF in Uzbekistan in commemoration of this day?
Mm-hmm. Yes, I think the key word is event and global. So we like in the UN, as you know, we like in UNICEF flagging during 1 day, 1 week, 1 month, an important event or an important element of our agenda, because we think we have to attract attention, we have to mobilize, and this Global Handwashing Day was indeed about mobilization. It was about attracting attention of general public on the necessity to hand wash in different circumstances, but certainly it means hand washing with soap each time we go to the toilet, each time we deal with food, each time we go to the bathroom. It's important that this takes place. And we have to mobilize, and therefore we organize once a year, this big global event. But this event, which is made of advocacy, communication, booklet, conferences, is important, but it needs to last longer than just for the event. It means it's an occasion to start a national campaign, a national improvement health strategies, for instance. And in the case of Uzbekistan, I'd like to mention that indeed 2012 was also the occasion to renew the commitment made by the authorities with the support of UNICEF on hygiene and sanitation. We have organized in early 2012 a study about the prevalence of helminthiasis, which is worm, and we noticed that there is important prevalence of worm in some region of the country. So we organized with the Ministry of Health a deworming campaign. But the deworming campaign is one shot. The pills are extremely cheap, it's easy to do, but just for the effect to last, it needs to be accompanied by social mobilization campaign. And this is where this hand washing day is important, because prevention of worms goes with hygiene and sanitation. So this is an element that is important. We have now a campaign in 2012, but this campaign will last another few years, because not only 2 regions, that was Fergana and Karakkal, Pakistan, will benefit of this. We now want to expand this campaign, deworming plus hand washing, to the entire country. So it's probably for us, UNICEF and our partners, a challenge of a few years. Now, another very nice initiative, there is currently going on in the country hygiene champion school, where it's a very small number of schools, but are competing with each other to provide the best pictures in terms of hygiene and sanitation, which is a provision of water, provision of soap, using soap for hand washing, but also having properly sanitation facilities for both boys and girls. So all these elements, which are event, but also campaigning, are contributing, I think, to the overall hygiene and sanitation of a country towards better health and sanitation. So I think it's what meant this national or global hand washing day.
Thank you, Jean-Michel. One of the key documents stipulating the work of UNICEF in Uzbekistan is the country program for 2010 and 2015 between UNICEF and the government of Uzbekistan. Could you tell us about the targets you've already met so far and what is yet to be achieved?
So, as you mentioned rightly, it's a 6-year program, and the end of this country program match the MDGs, the Millennium Development Goals. So UNICEF, as part of the United Nations in Uzbekistan, is working towards the achievement of the MDGs together with other UN agencies. And as you rightly mentioned, this is halfway. So we are currently looking at what did we achieve for the last 3 years, and what do we still have to achieve to reach together with Uzbekistan and for Uzbekistan and for the people in Uzbekistan, the MDGs. So we have not yet achieved the outcome. We have achieved some outputs towards the outcome of the country program. As you mentioned and as we talked before about education, in health, in protection sector, we still have a way to go. But something I would like to mention, because we have already looked at our achievement and also how could we improve together but with others. So something I'd like to mention is that certainly Uzbekistan is on the right track towards most of the MDGs. But what I like to say is we would like to have the all MDGs achieved for all children in Uzbekistan, or for all citizens in Uzbekistan, in all regions of Uzbekistan. What does it mean? I think we have to be better in terms of the analysis and finding what are the most vulnerable regions, what are the most vulnerable people, and trying to reach out these people instead of trying for the mainstream or working for the mainstream. And the challenge for all of us in the United Nations in Uzbekistan, I think for the next 3 years, will be to better targeting the ones who are in need of our support, for helping them to reach also the MDGs as the country will. Another element I'd like to mention, which is also related to the fact that Uzbekistan has moved from a less developed country to the middle-income country, is that we need to diversify the partnership we have for successes and for progress towards the MDGs. We need to accelerate and improve and probably also increase the partnership with the civil society. I think it's extremely important, not only the civil society which is based in Tashkent, but everywhere in the region where we have seen, as UNICEF, many of interesting initiatives by small community group, and we need to keep going with this, building their capacity to deliver for their own citizens. And another element that we are exploring now is partnership with the private sector. I think big corporations in Uzbekistan make a lot of success, in the economic sector, is to bring into the development agenda also the private sector. And this is an element that, as UNICEF, we are also looking forward in the coming period of time, is to bring the private sector into our own agenda and the agenda of the country in terms of development.
UNICEF, along with other UN agencies and partners, work on decreasing child and maternal mortality. And could you please share some latest updates in terms of the work done in this area, and maybe tell about interventions that led to significant decrease?
Yeah, I think it's more than a certain decrease. I think Uzbekistan has made mother and child health, to take the name, the slogan or the reference to an important event that took place in late 2011 in Tashkent, which is Healthy Mother and Healthy Child. This is really a priority for the country. It's obvious when we look at the budget that have been allocated to the health sector, since as the different laws and regulations that have been taken place since the independence. So the decrease in infant mortality, which means below 1 year old, the child mortality, which means below 5 years old, and the maternal mortality is quite impressive in Uzbekistan. And Unicef is really keen and very proud to have been associated since the beginning of that. And indeed, as you mentioned, as Unicef, we spend 50% of our budget on healthy mother, healthy child, and we have probably the biggest commitment in that aspect. So I would like to take the example of a project we have started in 2008, which is called Improving Mother and Child Health Services. And it was really about services. At the time, during this period of time, a bit more than 3 years, we trained about 13,000, 15,000 professionals. In 8 selected OKMIAT of the country. It is a very long process because we trained them during 3 years on 3 elements: safe motherhood, newborn care, and child care. And we saw, and this is the outcome not only of UNICEF evaluation, but really international evaluation and monitoring, an enormous change, even in terms of burden on the health sector. There is a decrease of 70% of time spent in hospital because of the new practices. Invasive medicines are decreased by more than 50%. 60% of the decrease in the cost, family pocket money, in terms of pharmaceutical and drugs, because of the different way of managing healthcare for this period of time, both for the mother and for the child. Which means that the region have made quite substantive economy in terms of the cost of the services offered. Because of the good result of this important project, now we are developing the second phase, which will cover the entire country and another 15,000 professionals. This will last from 2012 until 2015 included. So towards the end of the period of time we were talking before. So I think it's an extremely good achievement to an extent that the project is called Health Improvement of Health Services. But once again, we move from improving the services delivered for the population of Uzbekistan to a policy level, because we were talking about in-service training for the professional. Now, the government, the authorities, we're very pleased for that, have decided to also change the pre-service training, which is the school, the health school and the health universities. They will make this new way of curing and preventive care, they will make it the pre-service training in Uzbekistan. And this is the best achievement, because it means that by the end of this project, we are confident that the new general practitioner, the nurses, the patronage nurses will be trained in a manner that the improvement will be sustainable on the long run. So I think this is a successful story, but we still have a way to go the next 3 years. But we have good partnership. I was talking about partnership with other UN agencies, with the international community, to make this a success with the final outcome by the end for the MDGs, certainly.
Thank you very much, Jean-Michel, for your answers.
Thank you very much.
Having you in the project.